I can't remember exactly how it was phrased, but how medical practice contributes to the problem of antibiotic resistance and how long is it going to take for us to change that. And then the other question was about tuberculosis. I'll take the second one first. So we have multi-drug resistant everything. We have multi-drug resistant bacteria of different kinds. We have multi-drug resistant, HIV. We have multi-drug resistant tuberculosis. We have extremely drug resistant tuberculosis. And that is something that is not a huge problem in our country, but it does come up. And we have a certain limited number of drugs that we use to treat tuberculosis. And when a tuberculosis strain is resistant to the two main ones, which are isoniazid and rifampin, we say it's a multi-drug resistant strain of tuberculosis. If the strain is resistant to isoniazid, rifampin, another class called fluoroquinolones, and then one more, we say it's XDR, which is even worse. And so that is part of the bacterial antibiotic resistance problem, because TB is caused by a bacterium. But it's not as commonly faced in day-to-day practice, certainly not my day-to-day practice. I have much more experience with your first question, and it has to do with physicians prescribing or over-prescribing antibiotics. And we've already heard, and I agree fully, that most of the antibiotics consumed in this country are actually consumed in the setting of agriculture. And again, it's not to treat animals with infection, but it's as a growth promoter or to increase feeding efficacy and those sorts of issues. So that's a huge amount of antibiotic usage. On the human side of things, we as physicians certainly overprescribe antibiotics. Certainly people with upper respiratory tract infections, colds, sore throats due to viruses, acute bronchitis. Those people have viral infections and antibiotics don't help. Even though you might think in your head that antibiotic helped me get over my cold, I'm telling you that they don't help. And in fact, the chance of a person with a respiratory tract infection of getting a severe adverse reaction to the antibiotic is far greater than the likelihood that antibiotic is going to help them. And so, when you talk about even reactions severe enough to get them into an emergency room, severe allergic reactions, a type of diarrhea called Clostridium difficile diarrhea, those adverse outcomes are far greater than the likelihood the antibiotics are going to help somebody with a respiratory tract infection. Now, if they have bacterial pneumonia, obviously that's something different. And we talk about this all the time, and we try to educate other physicians, and we try to educate our patients. The problem and the obstacles that we face are, in some cases, it's easier to just hand a prescription for antibiotics to a patient than it is to take the time to explain to the person why they don't need antibiotics. But there have actually been studies that have shown that if the physician takes the time and explains thoroughly to the patient why they don't need the antibiotic, most patients will accept that. It's just getting the physician to do that or just handing out samples. That is a horrible practice. So we need to be more prudent about the way we use antibiotics. Now, having said that, even if we were 100% correct in our antibiotic usage, we would still have a resistance problem. And I'm going beyond your question, but it's probably worth talking about it now. These bacteria have been on this planet for longer than we have, much longer. They outnumber us by some huge factor. On Earth, there are, and I looked this up, I don't have these memorized all the time, bacteria outnumber us by a factor of 10 to the 22nd power. In terms of mass on Earth, they outmass us by a factor of 10 to the 8 or 9. The generation time for a bacteria is 30 minutes. For us, it's 30 years, give or take. So when you think about that, we're never gonna defeat bacteria, to be quite honest with you. Even on our individual bodies, we have more microbial cells on and in us than we do human cells. So most of us is actually them, not us. So to think that we would be so smart as to outsmart them we just need to take that off the table. But overuse of antibiotics promotes resistance and it helps it spread because we put selective pressure so the resistant bacteria survive while the other ones die off. And so that's where the antibiotic overusage issue or misuse comes in, is that it applies that selective pressure. And so the best we can hope, I think, is to sort of keep pace so that we have time to develop not only new antibiotics, which the pipeline is very lean there, but also vaccines and immunomodulatory drugs and better diagnostic tools so we can be more specific. So, it's a big battlefront, but, just a big part of it is better use of antibiotics. And we try. We teach our medical students, we teach our residents. Again, part of it is just it's easier to prescribe an antibiotic than to explain why you don't need it. Plus, many of us, again, I'm saying us, I try not to do this, practice defensive medicine. You never want to miss anything. What if I don't give antibiotics to this person and they die of bacterial meningitis? But, we just need to have a little bit more confidence in what we do.